Welcome back to Bloom. Repeated facial expressions, normal age-related loss of collagen and volume, plus everyday stress can cause deep lines to develop around the nose and mouth as we age. These are sure signs of getting older that we might not want. Well, Dr. Hermann and her staff are artists when it comes to filling in unwanted signs of aging and stress, and no one wants to look like a puppet. So joining us today to talk about removing those marionette lines is Dr. Hermann of Hermann Wellness. Welcome back, Dr. Hermann.
Great to be here.
So we were chatting about these sort of marionette lines, and you were saying that they can make us look sad even when we're happy.
Yes. I mean, it's just as we age, we sort of lose some volume in our cheeks, and some of the sort of downward trend of skin here can make us look sort of frowny in this area.
So we're talking about here, and then also you call
we call this the nasolabial fold.
Okay, thank you for saying that for
me.
me.
And this they call the marionette lines, which are, you know, those puppets that have like ventriloquist with a so it sort of creates a line.
So we're seeing here, this looks like we photoshopped it.
Right.
But tell me what you guys did here.
So this woman had juvederm in her marionette lines, the lower, well, and her nasolabial folds. But most dramatic improvement, you can see where she had these sort of just shadow, you know, creases at the corners of her mouth, extending towards her chin. And by putting some volume right in those lines, you're able to, you know, sort of have the cheek and the chin connect smoothly, where you don't see the shadow.
She looks younger. She looks happier.
She looks happier.
So when you're saying you use the juvederm, how is that administered?
So we do use very small needles. These are the smallest needles you can think of. We use numbing cream. There's also numbing in juvederm, so as we're injecting it, it's numbing. Juvederm is hyaluronic acid, which is what our collagen is made of. Our body breaks it down slowly over time. It lasts a year. There are, in this area now, there is an 18-month juvederm product called Velour that I also would use. And you know, you just basically inject a little bit right along here. And then you can look at it. So the fun thing about filler is you can see it.
Cool.
You know, say, I want a little more, it's perfect. You know, the people, you know, and then it will last a year to 18 months, depending on what you use.
So for this patient right here, we're seeing sort of that decrease in those nasal labia areas?
Yeah, so the nasolabial fold is the fold between the nose, which is the, you know, to the mouth. And that can also just make people look refreshed and more youthful.
And did she have the same sort of filler administration?
Yes.
Now, I know that you have done a lot of your procedures. Is this one of the ones that you've had done?
Absolutely.
Okay.
Yep, I am, you know, my next big birthday, I'll be 50, you know.
Shut up.
It's hard to, you know, maintain, you know. So, yeah, a little bit. You know, I am one of those, if you look at me, I have some shadowing here. I think it's natural to have something. It's not to be perfect. It's to be just refreshed. You know, and so a little bit will go a long way.
And you mentioned also, so this is not something that we want to wait to until it's really deep. Is this one of those procedures that we want to start preventing
Absolutely. There are some things, if you have a line and it's a deep line, filler will maybe help with the shadowing, but it won't necessarily erase the line. So it's helpful to kind of start when things aren't too bad off.
So if we have something and we're not sure it needs to be corrected, is it okay to just come with you and chat and you can kind of give us an overview? Okay.
Yeah.
So that's the first place to start.
And if somebody has a little something, I mean, there's even before filler, you can do a little Botox to help this area. You know, so if somebody's not sure, there's sort of baby steps.
Well, I love that. I love that you always start with the baby step and you always listen to your patients.